How does vascular obstruction relate to thrombosis, embolism, and infarction? Imagine a busy highway suddenly blocked by a fallen tree or a crash. Blood vessels work the same way, and blockages can cause serious problems. Vascular obstruction is when blood flow is partially or completely stopped inside a blood vessel. This can happen in arteries or veins and is often caused by thrombosis or embolism, leading to tissue damage called infarction. Thrombosis is when a blood clot forms right where it is. It happens when the blood vessel lining gets injured, blood flows too slowly, or the blood is more likely to clot than usual. This clot can stick to the vessel and grow, blocking blood flow. For example, a clot in a coronary artery can cause a heart attack because the heart muscle doesn't get enough oxygen. Embolism is when a clot or other material travels through the blood and gets stuck somewhere else. Think of it like a moving obstacle that suddenly blocks a smaller road. Most emboli come from blood clots that break loose from a vein or artery. Pulmonary embolism is a common example, where a clot from the leg travels to the lungs and blocks blood flow there. Infarction happens when tissue dies because it doesn't get enough blood for a long time. When a blood vessel is blocked by a clot or embolus and blood can't reach the tissue, oxygen and nutrients are cut off. The longer the blockage lasts, the more tissue dies. For example, if a coronary artery is blocked for too long, parts of the heart muscle die, leading to a heart attack. So how are these connected? Vascular obstruction can be caused by a clot forming in place, which is thrombosis, or by a clot traveling from somewhere else, which is embolism. Both block blood flow and cause ischemia, or lack of oxygen. If the blockage continues, the tissue will die, resulting in infarction. This sequence is important to understand because it helps doctors figure out how to treat these problems. In medical school, learning how thrombosis and embolism lead to infarction helps us understand many diseases. Recognizing these links allows us to diagnose conditions like strokes, heart attacks, or limb ischemia. Treatments often focus on preventing clot formation or removing the blockage to restore blood flow and limit tissue damage. Knowing this connection makes it easier to see how vascular problems can affect the whole body.